2021. I'm your host, Michelle Rodriguez, and again I will be filling in for Mr. Lesroy Williams. These weekly briefings are designed to provide listeners locally and internationally regular updates in relation to the management of the COVID-19 pandemic here in St. Kitts and Nevis. The briefings afford anyone listening an opportunity to ask questions or seek further clarifications on the issues discussed. I wish to acknowledge the presenters for today. Chief Medical Officer Dr. Hazel Laws, Superintendent of the Royal St. Christopher and Nevis Police Force, Mr. Cromwell Henry, Chairman of the NEOC and National Disaster Coordinator, Mr. Abdias Samuel. Before the presentations are made, I wish to remind you, our viewers, to send your questions to the NEMA WhatsApp at 1-869-466-5100. I will repeat that number, 1-869-466-5100. Superintendent of the Royal St. Christopher and Nevis Police Force, Mr. Cromwell Henry, will present his report.
Good afternoon, all, and pleasant good afternoon to all listening to this broadcast via whatever medium. We have been doing very commendable so far as a country as we continue to maintain low levels of new COVID-19 infections. This has come about as a result of your efforts and cooperation with the authorities and your compliance with the COVID-19 prevention protocols. However, we can lose all of this gain if we become complacent and fall back into old habits and behavior which are risky. Contact sports and certain social activity are some examples of activities we should be careful with and take every precaution to protect ourselves to avoid infection. Vaccination reduces your risk of becoming infected and is strongly advised. However, the non-pharmaceutical prevention measures which are legislated continue to provide good protection. Regulation 6 of the current Emergency Powers Regulation states as follows: any establishment that is permitted to operate shall make the necessary arrangements to facilitate social distancing and physical distancing, and shall A, ensure that all customers and staff maintain physical distancing of at least 6 feet inside or outside of their business, if a line to enter the business is required. B, determine the number of persons that may be permitted in the establishment at any one time by permitting one person for every 30 square feet of store space. C, place distance markers at least 6 feet apart, indicating where each customer must stand on a line at the checkout point or other line. D, place distance markers at least 6 feet apart on the outside of the establishment, indicating where customers must stand while waiting to enter the premises. We continue to emphasize the importance of following these protocols if we are to coexist with the COVID-19. Anything less will take us back to a place where we do not want to be. In addition to these distancing protocols, you are required to wear face masks when in public, practice good hygiene behavior, and avoid crowds and crowded places. Thank you.
Thank you, Mr. Henry, Superintendent Henry. And I will now invite Dr. Laws to give her presentation.
Thank you, Michelle, and a warm good afternoon to everyone. Situation report for today, Wednesday, November 17. We continue to respond to the COVID-19 pandemic. We have done a good job so far in terms of containing the third wave of infections. And so over this past week, we've only added 26 new cases. So the case count for this past week is 26, 18 cases less than the previous week. We've only admitted one individual to the hospital over this period. We've discharged two COVID-19 positive patients, and we've had 62 recoveries during this period. Today we will we are notifying you of an additional COVID-19 related death. This recent death occurred, and it's an individual who was unvaccinated. So this is the summary slide. It provides you a snapshot of the COVID-19 with 2,304 cases reported on St. Kitts and the remainder on Nevis. We continue to enjoy a significantly high recovery rate, with 2,670 cases recovering fully, and that leaves us with 58 active cases. So we are monitoring 5 active cases on the island of Nevis and 53 active cases on the island of St. Kitts. And these numbers are the lowest they've been in months, and we are happy, and we hope that the number of active cases continue in this direction, meaning continue to decrease. At present, we only have one individual admitted on the COVID ward at the JNF General Hospital. And as I said before, we now have a total, or we are now reporting a total of 28 COVID-19 related deaths. When you analyze the demographic data of the individuals who would have died, we realize that 86% of the 28 cases, the individuals were unvaccinated, and 68% were 60 years and over. So what does this equate to? This data is really telling us that if you are an older adult, and meaning 60 years and over, if you are unvaccinated, if you're still unvaccinated, and I dare say add if you are, if you have one of the chronic non-communicable diseases, or if you have a number of comorbidities, your risk of becoming COVID positive is increased, and so is your risk of developing or progressing to moderate to severe disease of COVID and even severe COVID. And so those of you who are older with multiple comorbidities, we are asking you to note this information, empower yourself with the knowledge about the COVID-19 vaccines, and come on board. When we look at the data regarding the positive cases, the 2,756 positive cases, we realize that 70% of the cases were not vaccinated. And so again, if you are in the Federation and unvaccinated, your risk of being diagnosed with COVID is significant. Now, the Ministry of Health conducted a comprehensive audit of our COVID-19 vaccination data. And so we want to thank Dr. Rosales, our national epidemiologist, and Ms. Akila Moore, our medical statistician, based in the Health Information Unit at the Ministry of Health. So they conducted this audit, and this afternoon, the dashboard. So as at 8 a.m. this morning, Wednesday the 17th, 24,509 individuals were deemed fully vaccinated. So in other words, that gives us a coverage rate of 79.3% of the adults receiving the first dose, 72.6% of adults fully vaccinated, and 13.3% of the children 12 to 17 year age range, they have received the first dose, and 10.6% the second dose. By the end of work day this afternoon, we note an increase in the coverage rates, and so 79.4% of our adults have now received the first dose, 72.8% of our adults are now fully vaccinated, 13.3% of our children receiving the first dose, and so we see by this afternoon, a 0.2% increase in the number of children 12 to 17 years who are fully vaccinated. And so this provides you the revised vaccination data. And I want to repeat that 52% of the population is now fully vaccinated. Now, I think I showed this slide about 2 weeks ago. This just highlights the SARS-CoV-2 variants of concern. So the Alpha variant was first identified in the UK, the Beta in South Africa, Gamma variant in Brazil, the Delta variant in India. It's important to note because when you look at what's happening in the pandemic worldwide, you realize that the Delta variant is quite prevalent. And so this was first identified in India. Now, in terms of the Caribbean region, there's a little difference. Now, when CARFA analyzes, they provide us a summary of the data in terms of the samples they receive for genomic sequencing from the Caribbean member states. And so in the Caribbean region, the Gamma variant is the more prevalent. 41% of the samples positive for Gamma, 34% positive for Delta. And so if there is, there is interregional travel. And so the risk of spread of Gamma variant, Delta variant is quite real. And so is the Alpha, because 16% of the samples were positive for the Alpha variant. So that speaks to the risk. I'll give you an idea as to the risk in the Caribbean region. Now, the Delta variant is the predominant variant in the United Kingdom, the United States, Europe, Canada. These are our source markets. So the cruise ship passengers and the inbound air travelers, they're really coming from these destinations, the US, United Kingdom, Canada in particular. Please note the Delta variant is predominant in these territories. Now, in the United States of America, as we approach winter, the case counts are starting to rise, especially in the West, on the West, Midwest. Now, the case counts, they note, however, remains quite low in the Northeast, on the North Coast, on the eastern coast of the United States, where the vaccination rates tend to be high. And then this just shows you what's happening in terms of the vaccination rates in the U.S. So again, states where the vaccination rates are high, that's a protective measure in terms of the uptick in terms of the number of cases of COVID-19. So we need to continue to push our vaccination program because that's the best protection we have in terms of COVID in general and the Delta variant. The CDC, data tells us that people or persons who are unvaccinated are of a much higher risk than those who are fully vaccinated to test positive with COVID and to die from COVID. And so this is what the data is showing. Again, our source markets, the vaccination rates are quite high. And so their travel advisories are quite stringent. Canada enjoying, good vaccination coverage rates. So there is a big cry for our borders to be completely open. What does this really mean? This really means that there are individuals who want the air traveler and the sea traveler to disembark and integrate into our society. And so the policymakers and the decision makers would have to ultimately make a decision as to the way forward and how open will our borders be. The Delta variant is coming. Are we ready? This is a rhetorical question. Are we ready for the Delta variant? And so, ladies and gentlemen, that fourth wave seems inevitable. It's just a matter of time. And so we need to prepare ourselves. And there are measures that we can take to prepare ourselves for this eventuality. So how can we prepare ourselves for the Delta variant? Well, first and foremost, we need to strengthen our COVID-19 vaccination program. So, ladies and gentlemen, we need to increase the momentum in terms of our COVID-19 vaccination drive. We need to collaborate with the Ministry of Education and organize mass vaccination sessions for our teenagers between 12 and 17 years. We need to actively target the vulnerable in our population. So I want to use this forum to speak to our private practitioners. You have a number of clients who are 50 years and over with multiple chronic non-communicable diseases. We want you to be intentional in reaching out to them, to those who are not yet vaccinated. Have that one-on-one discussion to empower them, to bring them on board in terms of vaccination. Because this is the best protective measure that we have currently. We need to follow up the COVID-19 first dose recipients, those who have been tardy in coming back for their second dose. And we need to actively target persons who are working in high-risk sectors. So those taxi operators who are driving the COVID-19 certified taxis, the hotel workers. Now, the management of the hotels, they are the ones crying for us to open our borders. But we want the hotel workers, those employed in the industry, to come on board and accept the vaccine, because that space is considered a high-risk space. And the other individuals in the tourism and the hospitality industry, so those individuals working at the attraction sites, and our healthcare workers who have to interface with those who are symptomatic and diagnosed with COVID. So we need to actively target these individuals and bring them on board, because as I said before, the COVID-19 vaccine is the best protective measure that we have to date with respect to the Delta variant or any of the COVID-19 variants of concern. We need to practice the COVID-19 prevention and social measures. And we've been singing this song for the past 2 years. It's an all-of-society approach. It has done us well. It has brought us hitherto. But right now, we need everyone to come on board in terms of recognizing the importance of these measures. These measures can protect you, your family, can protect me, my family, our communities, and the Federation as a whole. So in terms of wearing the face mask, it's critical. So if our decision makers, if the cabinet members decide that we are going to fully open, meaning, inbound air traveler can enter and integrate freely. If perchance the cruise passenger can integrate, can pass if we take down the fence at Port Zante, we really need to keep our face mask on, because you'll be interacting with cruise passengers, you'll be interacting with layover passengers. And so if you're going to the grocery store, if you're going to the pharmacy, if you're going to the bank, if you're going to pay a utility bill, electricity bill, water bill, the teller machine, please keep on your face mask. It's very important. If we are going to fully open, back one slide. Yes, hand sanitization, hand hygiene is very, very important. Now, this makes a difference between those who contract the disease and those who fare well. And so if you are going to interact with anyone, you know, hand a package or a letter, a document, or receive, you need to sanitize your hands after. If you're going to touch a high-touch surface, you need to sanitize your hands, now more than ever. And physical distancing, depending on where you're going, maintain that safe distance to protect yourself and your loved ones. Now, we are approaching Christmas, and so there are a number of events being planned. And so there is a document that is being developed to guide the operations in terms of the entertainment industry. Now, there's a recommendation for the resumption of entertainment, and this would be for fully vaccinated events at 75% capacity. And so we want the event organizers to note this. Ladies and gentlemen, November the 14th was celebrated as World Diabetes Day. The theme for this year, access to diabetes care, if not now, when? Now, in the Federation of St. Kitts and Nevis, we have 11 health centers, St. Kitts, 6 health centers, Nevis. And if perchance you've been diagnosed with diabetes, you can walk into any health center and access care. You can go into any private practitioner's office and access care for your diabetes. And so we want to reach out at this time to all diabetics. Make sure that you are compliant with your medication, if it's insulin or one of the anti-diabetic medication. Because in the context of COVID, it's very important for you to maintain normal blood sugar levels. So if you are diabetic and perchance contract COVID-19, you fare better if your blood sugar values are within the normal range. And so if you're diabetic, you need to be compliant with your medication, compliant with your diet to ensure normal blood sugar values, so that if perchance you contract COVID, you will recover without much problems. I want to help my colleague, Dr. O'Loughlin. He would be proud of me in sharing with you the St. Kitts Diabetes Association information regarding the Diabetes Association's 7th annual walk. It will take place this coming Saturday morning. And so if you are going to join us, you are expected to be at the War Memorial by 5:30 a.m. The walk commences at 6 a.m. Looking forward to seeing you there. Ladies and gentlemen, let us be very serious about the COVID-19 protective measures. Accept the vaccine if you are not already on board. Wear your face mask at all times. Maintain adequate hand hygiene and an adequate distance from others when in the public domain. And if you are perchance ill, experiencing any of the COVID-like symptoms, we want you to remain at home. These are the protective measures. These are the measures that are going to protect us from the Delta variant and that inevitable fourth wave. We will fare better if all are on board in terms of adhering to these protective measures. Good afternoon, and I thank you.
Thank you, Dr. Laws, for that informative presentation. I wish to acknowledge the co-chair of the Disaster Mitigation Council, the Honorable Wendy Phipps, who is present with us this afternoon. Just a gentle reminder to our viewers, if you have any questions or need any clarifications on any of the presentations being made thus far, Kindly send your questions to NEMA WhatsApp at 1-869-466-5100. I will invite the chairman of the NEOC and National Disaster Coordinator, Mr. Abdias Samuel, to give his presentation.
Thank you, Michelle, and pleasant good afternoon to all who are listening and viewing via the various means. Michelle, I think you've been doing a great job in the absence of Mr. Lesroy Williams. So I think we are grateful to you for hosting. Ladies and gentlemen, I want to update you regarding the many engagements that the task force would have convened over the past week. And they are numerous, as we see that the tourism sector is beginning to show good signs of reviving, whether it be the cruise passengers, as we are seeing 2-3 ships on a regular basis now docking at our ports, meaning at Port Zante and also at the South Friars Bay. Equally so today, our sister island, Nevis, would have also seen a ship, a small cruise ship with approximately 530 passengers thereabout, also docking at the Charleston, in the Charleston area. This is significant for us as we have taken a very balanced approach into reviving our economy here in St. Kitts and Nevis. However, like everything else, there'll always be challenges, and I am appealing to everyone in the tourism sector in particular to, again, go get vaccinated. It's very important. It builds resilience, and it gives us the competitive edge against our competitors around the region to be able to be a marquee destination and also to remain solid in providing these services. So I want to echo the sentiments of the colleagues who have gone before me to do your best, help us in the all of society approach, and go and get yourself vaccinated. The National COVID-19 Task Force would have met with the St. Kitts and Nevis Football Association executive, and this meeting would have taken place on the 9th of November. The initial meeting took place on the 9th of November, and on the 15th of November, there was a subsequent meeting. The meeting, in attendance at this meeting were cabinet ministers, the Honorable Sean Richards, Acting Prime Minister, Honorable Akila Byron Nisbet, Minister of Health, the Honorable Jonel Powell, Minister of Education, Youth, Sports and Culture, the Honorable Vincent Byron, Attorney General, Minister for Justice and Legal Affairs, and he's also the Chair of the Disaster Mitigation Council. Also the Honorable Wendy Phipps, Minister for International Trade et al., and the Co-Chair of the Disaster Mitigation Council. I think this meeting was very fruitful. We were able to meet halfway, whereby there is much support for the sporting fraternity for them to return to apply their social activity, which I know is like a religion here. And I think subsequent to that meeting, there were other meetings with the Ministry of Health. I think would have been, in attendance would have been Dr. Wilkinson and others, whereby there was an educational awareness session to encourage the players themselves to be vaccinated, because football is a highly competitive sport. So again, I want to appeal to our community sporting fraternities and groups to do their best and get yourself vaccinated, as we don't want you to go into quarantine and cause you to lose a cup. That's very important. The task force also met with the St. Kitts and Nevis Amateur Athletic Association, represented by Mr. Delwyn Delaney, and there was another gentleman with him. And they presented a very comprehensive plan as to how this particular track and field event can take place within the context of COVID-19. Equally so, they presented for the junior team and the senior team, and I am happy to announce to the general public that they have a high vaccination rate for the senior team, and that was it's very commendable, and they are very active in ensuring that they get their members and athletes vaccinated. So we want to commend the SKN AAA for the work that they are doing in building resilience during this time. Subsequent to these meetings, we are going to have meetings with the SCABA, St. Kitts Nevis Basketball Association. We also plan to meet with the cricket associations, volleyball associations, and the other sporting fraternities here in St. Kitts and Nevis. And then we're going to bring everybody collectively together so that we could actually formulate the plan, policies, and procedures to be able to resume sport in a very safe and practical manner. And again, I want to emphasize the point that at times you will have international matches, and if you're aspiring to have international matches, access some of the scholarships in the United States of America, it's best that you consider the possibility of being vaccinated to be a team player, because you can affect your other teammates and also affect their families. So if you could do your best to get vaccinated, that will be a critical thing for you to do as a sporting fanatic, athlete, and a team player. The National COVID-19 Task Force also met with the hoteliers on St. Kitts and Nevis, and I must say it's one of the most fruitful meetings that we would have hosted and convened with the hoteliers both on St. Kitts and Nevis, and a number of recommendations were shared by the hoteliers, and you would have listened to the presentation made by the CMO, where all we are asking for is a collaborative approach for us to be able to continue with the resiliency and the roadmap to economic recovery. We cannot do it without using the tool that is available to us, which is the vaccination process. So some of the hotels did report that they have up to 80 and almost 100% vaccination rate. Some of them are struggling with the vaccination of their staff. I just want to share with you in some of the dialogues I would have had with some of these managers. For example, one individual comes in and is infected with the COVID-19 virus. That individual then infects all the persons and their shift and maybe others in other departments that they interact with. Then that will require that a number of these persons who are not vaccinated will have to go into quarantine for a period of 14 days, and that individual will have to go into isolation until they recover. Ladies and gentlemen, it's difficult, and that is not resilient. We are in a geographical area whereby we have to be competitive with the likes of the Virgin Islands, the Barbados, Antigua, who is our major competitor, St. Martin. And in listening to some of the guests and persons and some of the feedback, it is easier for some guests, they are saying, to go St. Martin, where they have an easier way to enter and be able to enjoy the resources, or the natural resources of St. Martin, than to come to St. Kitts and Nevis. And that will affect us because we are dependent on tourism. So again, I am appealing to all in the particular sector to do your best and become vaccinated. It was a joy for me yesterday to engage the taxi operators. Some of you might have seen a video circulating, but there was some concerns raised, and we went there and we engaged myself, Superintendent Henry, and the Honorable Acting Prime Minister, the Honorable Sean Richards, Acting Prime Minister, would have also joined us for us to sit down with them. And it's important to listen, because everybody makes a significant contribution. And some of the concerns were genuine concerns that they've had, and we are going to do our best to address these concerns. And also, some of the concerns are things that can be dealt with immediately through partnership, collaboration, cooperation, understanding, and the application of good senses. So I think the engagement yesterday with the taxi operators was great. We have been in discussion and in contact with the major tour providers, and they themselves have provided a lot of opportunities for the independent taxi operators and the smaller taxi operators. Things are not the same. Things are different because of the context of COVID-19. We have also been in discussion with a number of partners about the primate vendors, and also we have recently approved the operations of the hair braiders and the ala rub operators, etc. So we are taking a gradual process in our economic roadmap to recovery in the tourism sector in getting everybody again back to work. Our understanding is that the Tourism Authority is doing the best to somewhat guide and have organized details of how persons are going to access or be able to provide these services in certain tourist attractions. And yes, the concern has been raised because I have received a number of calls and concerns about this late stayover guests and the cruise ship guests, and the high demand that is there in the Federation right now. And we are going to take a balanced approach. I was just on the phone with the Honorable Sean K. Richards, the Deputy Acting Prime Minister, as well as the Attorney General, regarding looking at policies and procedures to sit down and discuss with the task force about how do we manage the high demand of tourists entering the Federation of St. Kitts and Nevis. For example, some of the hoteliers has indicated that the numbers are increasing in terms of the uptake in guest arrivals. So when they would have been expecting maybe 30, 40%, they have gone beyond the 50%. But one of the things in coming back to the cruise ship that I want to say to you, the general public, is that even though we had 3 cruise ships yesterday, and from the numbers shared by Tourism Authority, we had approximately 5,000 persons yesterday. But what was also significant for me when I was speaking with the CEO of tourism is that those 3 ships should have had approximately 10,000 plus passengers together combined on the ground. But the ships are operating at a 40 to 50% capacity. So it means that the jobs that you may have gotten in the past are also reduced to approximately a 50% chance as well. So I just want us, again, that's why I said understanding, collaboration, the sharing of information is critical in solving a lot of the challenges and concerns being raised by service providers in the tourism sector. So I want us to be mindful that we are working with you. We are doing our best to bring balance to the whole situation, and we are hopeful that as we get accustomed in the new norm with the COVID-19, that we can actually have harmonization amongst all stakeholders. Yes, the question is there about the fencing and bringing down the fencing, but once the fencing comes down, it means that a lot of other barriers have to come down as well. So what we have said is that we are going to take a gradual approach in taking the necessary steps to let the fencing down. We have to prepare the general public, we have to prepare everybody, because that means that the tourists may be able to jump in a public transportation, which is, public buses, and might go to places. They're going to be interacting with our general public to a high degree, and we still have persons who are not vaccinated. So we are asking persons, let us reach that threshold. We said 80%. We are soon there, and do your best. If each one takes one and we reach that threshold of 80% vaccination, then I think the cabinet should feel comfortable in knowing what risk they are willing to absorb here in St. Kitts and Nevis. In particular, looking at the low vaccination rate for our underage teenagers at the age of 12 to 17, I think it is. So if you help us, we are able to help everybody to get to where we need to get at. I want to make a special appeal to the red caps in particular. There's a very low vaccination rate. There's a high demand as stipulated by the hotel operators or the hoteliers. For example, one hotelier stated that when they have guests who are paying $2,000 a night, they expect certain level of services, and not having our red caps operating in the arrival side is very critical, and is something that we have been trying to work with the red caps, and we have asked Mr. Philip, the CEO of SCASPO, to convene a meeting with the red caps where we will all be present and give them an opportunity, as a number of recommendations have come from the hoteliers, whereby these services can be provided with persons who undergo the training and persons who have received the seal of approval. So I am appealing to all the red caps to do what you need to do to become classified and qualified to operate within that particular sector, as we are seeing the numbers of passengers arrival increasing significantly for us here in St. Kitts and Nevis, bearing in mind that we are now going into the festive season. So we have to make this strong appeal to everyone to be responsible, do what you need to do, help us in this cause. It's all of society approach, and we are heading also into the carnival season. And I would like to end with the carnival season. I was just being notified and informed by the Attorney General, the Chair of the National Disaster Mitigation Council, that Cabinet has agreed to approve the carnival recommendations as stipulated. And also, the task force would have also made a recommendation after our meeting yesterday to have the curfew lifted. And I am pleased to inform you that the Cabinet has approved for the full lifting of the curfew from the regulations. So when you see the new iteration of the regulations, there will be no more curfew in St. Kitts and Nevis. Thank you very much.
Thank you, Mr. Samuel, for the information shared. And now for the exciting part of our briefing, the questions and answer segment. We have 3 questions from Von Radio. The first question is, given the approaching busy season, will any additional measures be in place to ensure that the COVID-19 case number remain low, particularly since more air and sea traffic are anticipated now compared to 2020? I can read it again. It says, given the approaching busy season, will any additional measures be in place to ensure that the COVID-19 case number remain low, particularly since more air and sea traffic are anticipated now compared to 2020? The second question from Von Radio reads, as mentioned in a previous NEOC briefing, a number of test samples were sent off to verify if there are any additional variants that are in the Federation other than the Lambda variant. Could you give us any update on that? I'll read it again. As mentioned in a previous NEOC briefing, a number of test samples were sent off to verify if there are any additional variants that are in the Federation other than the Lambda variant. Could you give us an update on that? And the last question for Von Radio, is there any update on when the next batch of Pfizer vaccines will arrive in the Federation? Is there any update on when the next batch of Pfizer vaccines will arrive in the Federation?
So, Michelle, I think I answered the first question comprehensively in my presentation, where I highlighted the fact that we are approaching the Christmas season, whereby we are expecting an increase in the inbound travelers by sea and air. And I went a step further and said that we are at risk of the Delta variant being reimported into the Federation. And I went through the steps that we can take to prepare ourselves for the eventuality of a 4th wave, delay or prevent that. And I'll just go through the steps. Vaccination, that's the best protective measure that we have. And the other COVID-19 protective measures, wearing the face mask, hand sanitization, and appropriate distancing. These are the measures that have worked. These are the measures that have brought us hitherto, and these are the public health measures being employed regionally and internationally. They may seem simple and trivial, but this is what is going to protect us from the Delta variant in this upcoming season. In terms of the last batch of samples that were sent to CAFA for genomic sequencing, we are awaiting the results of same. It takes about 2.5 to 3 weeks for us to get the results. But as we've done in the past, as soon as the results are received, we will share with the public.
Were you going to present?
All right, so yes, we've received the first of 3 batches of Pfizer-BioNTech vaccines from the United States government. All right, so this batch, we received 11,700 doses. I think we've utilized almost 4,000 doses already. So even before asking about the next batch, I think we need to utilize this present batch. And so I want to ask Von Radio to help us in terms of public service announcements and little clips whereby you share with the general population information about the Pfizer vaccine so that more persons can be empowered and come on board to utilize the existing or present batch of 11,700 doses. Thank you.
Dr. Laws, I believe you would have answered this question. However, it specified Nevis, so I will read it. On Nevis, it would appear booster jabs after 6 months of second jab are not available for over 65 senior citizen. No date has been given when it will start. Booster jabs appear to be available on SYNCITs. Why the difference?
What I can say is that that is not necessarily so. Just yesterday, I was in a meeting with the public health nurses, both from St. Kitts and Nevis, discussing third doses and booster jabs, and all of the public health nurses from Nevis were there, and they were fully educated on the process. So I'm pretty certain that if they haven't started, they'll be starting. They started probably today or from tomorrow.
I believe this question is for, okay, let me read the question. Why is it a vaccinated patron cannot visit the stores at Port Zante when cruise ships are visiting?
We have said all along that the best way to protect ourselves from COVID-19, in addition to adopting the non-pharmaceuticals, is getting vaccinated. We have also said that no one is safe until everyone is safe, and we are attempting to reach through a certain threshold of population immunity before we can fully open up the country. The benchmark that was set was 80%. I'm happy to see that as of today, we are at 79.4% of adults with at least one shot. Until such time, we have to make sure that we create certain bubbles to prevent the spread of COVID-19. And so you would have heard of certain bubble events. CPL, for example, was a bubble event. When we speak about having certain indoor activities with only vaccinated persons, those are bubble events. And there is a bubble that is created at Port Zante. And so to avoid the interaction of persons coming off the cruise ship with persons in the general public who may not be vaccinated, we have the barrier created there. Now, there is going to come a point in time when the barrier will come down, and vaccinated and unvaccinated persons will be able to go into Port Zante. The issue here, though, is when that time comes, the persons who remain unvaccinated, they would still remain a risk to themselves. And so my recommendation to those persons, if you can be vaccinated, you need to go forward and get vaccinated. You have heard the CMO said again today that we added one more death in an unvaccinated person. A number of those deaths that we've had, they have been unwarranted. If many of those persons had gone forward and gotten vaccinated, they might have been here with us today. And so I want to urge everyone, if you want to see the barriers come down, if you want to see the bubbles go away, if you want to see persons mingling and interacting with some sense of normalcy, the answer is right at our hands. We need to go forward and get vaccinated.
Okay. Thank you, Dr. Wilkinson. The next question reads, there's a strong advocacy for individuals with underlying medical conditions to get vaccinated. What measures are put in place for aftercare treatment for these persons who may develop adverse reactions after being inoculated?
I think there is a great misunderstanding that persons have about who needs to be vaccinated. And in a situation, for example, if vaccines were scarce, and the persons who would be going forward or who would be asked to go forward to get vaccinated are the persons with pre-existing conditions. Because what you have to ask yourself is this, is if I got COVID-19 today, will I survive? And so if you have diabetes, if you have hypertension, if you have heart disease, if you have kidney disease, and you get COVID-19 and you start to huff and puff because you're having difficulty breathing, because your lungs are being filled up with inflammatory fluid, you may not survive the night with those pre-existing conditions. And so that is why you need to go forward and get vaccinated. Now, as it relates to the vaccine, there are hardly any significant side effects associated with the vaccine. As of today, more than 4.9 billion doses of the vaccines have been delivered. And the side effects documented from the vaccine, they are very, very minimal, but hundreds of thousands of persons have died from COVID-19, and hundreds of thousands of persons continue to have long-haul symptoms associated with COVID-19, although they would have recovered, meaning that they are now testing negative and have no active viral multiplication within their body. And so if you are someone out there with pre-existing conditions, you need to go forward and get vaccinated. I think the CMO would have said in her presentation also, the majority of the persons who died from COVID-19, these are persons who also had pre-existing conditions. So in addition to having COVID-19, because of the pre-existing conditions, diabetes, hypertension, heart disease, kidney disease, they would have been pushed over the edge. Okay, so if you're out there with any existing condition, you need to go to the clinic tomorrow and get vaccinated. That's the safest thing you can do to save your life.
Thank you, Dr. Wilkinson. It was just mentioned that St. Kitts Carnival will be on stream and has been approved. Will the shows be virtual, as you mentioned during your presentation, that we can't let our guards down during the upcoming fast-paced season?
Yes, we are doing our best to make sure that we have a safe carnival, because we would have said here before, what we don't want to see is come January, we have a rising number of cases. And so the protocols and procedures that have been put in place to make this carnival safe is to protect all of us. And there are going to be a number of virtual events, and there are going to be a number of in-person events. And I think you'd have heard that for the in-person events, they would mainly be for vaccinated persons if it's in an enclosed space, and the capacity would only be 75% so that there could be adequate social distancing. So if you're vaccinated, if you're properly spaced at this event, the risk of you contracting and spreading COVID-19 is significantly reduced, and so those events should be fairly safe.
Someone wrote, I heard in the news Pfizer claims it appears the vaccine lasts only 6 months. Shouldn't everyone be getting a booster shot? That's one question, and I'll read the next one. What has happened to herd immunity? If attendance at a show is 75% vaccinated, why can't they herd the other 25% attendees?
I think it's a very interesting question because just recently I was speaking to a very good friend of mine who loved to play mass and enjoy himself during Carnival. And he told me that he was going to be protected by the herd, which means that he was not planning to get vaccinated, but was hoping that persons around him get vaccinated so that he can be protected. But in this fight, we all have personal responsibility. And if you need to get vaccinated, you should go out and get vaccinated. You would have hardly hear us mentioning the word herd immunity over the last several presentations, because with COVID-19, because there's a risk of breakthrough infections, we find that the threshold of population immunity keeps getting higher and higher. So early on in this fight, persons spoke about 70% to reach herd immunity, then it went to 75, 80, and what we are finding is that almost every single person who should be vaccinated need to go out and get vaccinated so that we can stop COVID-19. There are some diseases like measles that are highly infectious where you have to have 97% of the population vaccinated to stop the spread of measles, and so COVID-19 is like that, and so we need to make sure that everyone who can be vaccinated go out and get vaccinated. It's not that we reach 70% and we stop. Now, as it relates to Pfizer, I think we have to be careful with misinformation. Pfizer did not say that after 6 months you don't have any immunity. The studies have shown that after 6 months your immunity may start to wane, and that is why they're recommending the booster shot. Now, there would come a point in time when the booster will be offered to everybody if the vaccines are widely available. But again, we say no one is safe until everyone is safe. And the World Health Organization philosophy is that we need to get at least 40% of every population in the world vaccinated in order for us to make a dent in the fight against COVID-19 globally. And yes, there are some first world countries that's offering the booster shot to anyone who walk in to get it. But here and in most other countries, the recommendation is if you're 65 and older, 6 months out, you can get the booster shot. If you're 18 years plus with pre-existing conditions, and that covers quite a number of persons, you can get the booster shot. If you're working in a high-risk area, for example, if you're in the health field, if you're working in an institution like a prison or a nursing home, you can get the booster shot. That is if you're 18 years and older, or if you are living in one of those facilities. If, for example, you are an inmate in the prison, or if you're a resident at a nursing care facility. So the booster shot is available for quite a wide category of persons. Thank you.
Someone just asked a question about UK. Let me just find. Made a reference to UK. Okay. It says, as the UK do not require COVID-19 tests for fully vaccinated persons to enter, does SINCIS require tests to leave the island? Let me read the question again, sorry. As the UK do not require a COVID-19 test for fully vaccinated persons to enter, does St. Kitts require a test to leave the island?
Well, first of all, in addressing this pandemic, there is no one-size-fits-all approach. And so every country has to look at protocols to protect their system, because there are some countries that can absorb more risk because they have, greater financial resources. They have a very broad-based healthcare system where even if 10, 15, 20 persons got sick, they can continue to move forward. When we live in these small countries, our systems can be very fragile, and so you still require a negative PCR test to enter the Federation of St. Kitts and Nevis. When you're leaving, you're free to leave without any tests. The test that you get when you're leaving depends on the requirement of the country that you're going to. Okay, and so if you're going to Timbuktu and they don't require any testing, you will leave without a test.
Okay, I think that will be it for the questions for today. I want to thank everyone for their questions. And for those whose questions would not have yet come in, we can post it for next week. We would like to thank everyone for tuning in for today's briefing. And I also would like to thank those who would have sent in their questions as we continue to provide you with accurate information on the management of the COVID-19 pandemic here in the Federation. We continue to urge you to follow all the protocols to keep you, your family, and by extension, the Federation safe. We thank all our presenters today, the Chief Medical Officer, Dr. Hazel Laws, Superintendent of the Royal St. Christopher and Nevis Police Force, Mr. Cromwell Henry, Chairman of the NEOC and the National Disaster Coordinator, Mr. Abdias Samuel. We thank Mrs. French for her usual assistance in sign language. We do express sincere thanks to Open Interactive for providing us with a backdrop and also for some of the furniture being used during the briefing. We wish to thank our technical team, the ZIZ technicians, all media communications, and our ANIMA staff here at the NEOC. I also wish to thank Dr. Cameron Wilkinson as well, who would have taken the time out to answer some of the questions. As we conclude today's briefing, and I erred in also mentioning, thanking co-chair, Mrs. Phipps, for being here as well. As we conclude today's briefing, I wish to leave a quote from Nelson Mandela. Today we should all ask ourselves, what have I done to improve the surroundings in which I live? As you ponder on these words, I wish to thank all of you for listening. I am Michelle Rodriguez saying, do have a great evening.